Were you aware that regularly consuming certain types of nuts could heighten your chances of developing heart issues by nearly 50%, especially if you're past the age of 60? This isn't just speculation. The figure is backed by long-term research featured in the Journal of the American College of Cardiology. Here's the alarming part. Many older adults believe they're choosing nutritious snacks, yet some of the most commonly consumed nuts in households may stealthily raise blood pressure, ignite internal inflammation, block arteries, and even contribute to cognitive decline. One specific nut, which we'll name later, has been associated with a harmful substance that builds up over time and may impair liver, kidney, and brain health if eaten often. Surprisingly, this nut is a staple in many low-carb meal plans, yet it may be inflicting lasting harm on aging bodies, and odds are, it's sitting in your pantry right now. But don't panic. This video will clarify everything, from the most beneficial nuts for heart and brain wellness to the ones you should eliminate immediately. Consider this your go-to reference. Make sure to watch until the conclusion, because the worst offender on the list hides a disturbing truth that rarely gets discussed, one that might be quietly undermining your health. Before diving in, drop a comment below sharing your location, and be sure to like and subscribe for more content like this. Now let's move on to 4 types of nuts that are especially beneficial for seniors. First up, almonds, a fantastic support for skeletal strength. Almonds are often praised as one of nature's finest offerings for older adults, largely thanks to their rich supply of both calcium and vitamin E, which work hand in hand to fortify bones. As the body ages, bones tend to weaken and become more susceptible to breaks. Eating just a small handful of almonds, around a quarter cup, gives you close to 97 milligrams of calcium, a vital nutrient that helps slow down the natural bone density loss that tends to accelerate after age 65. But what truly makes almonds shine isn't just their calcium, it's that they come bundled with magnesium. Many elderly individuals lack adequate magnesium, a mineral that helps the body effectively transport calcium to bones rather than letting it build up in arteries, where it can cause harm. On top of that, almonds are packed with heart-supportive monounsaturated fats that can help reduce LDL, bad cholesterol, an increasingly important benefit as cardiovascular risks rise with age. Older adults are advised to consume roughly 12 to 15 almonds per day, ideally in their raw or unsalted roasted form. Each serving delivers about 3 grams of fiber, which can help ease constipation, a problem that affects nearly 2 out of 5 seniors. Even more impressive, studies conducted by Tufts University have shown that almonds offer a unique mix of antioxidants that safeguard brain cells from oxidative stress, potentially helping delay mental decline. For maximum antioxidant benefit, choose almonds with their skin intact, as the skin contains plant compounds called flavonoids that amplify the protective effects of vitamin E. Just keep in mind, if you or someone you care for has trouble swallowing, it's important to chew almonds thoroughly to reduce the risk of choking. Next, we have walnuts, the go-to nut for brain enhancement. Walnuts are unmatched when it comes to supporting cognitive health in older adults. Interestingly, they even resemble the human brain in appearance, a fitting coincidence. These nuts are the richest source of alpha-linolenic acid, ALA, a plant-derived omega-3 fatty acid, among all common nuts. This is vital for aging minds, as omega-3s play a key role in preserving brain cell structure and ensuring smooth communication between neurons. A notable study published in the Journal of Nutrition revealed that seniors who consumed 1.5 ounces of walnuts daily for 2 months experienced meaningful improvements in thinking speed and adaptability. Walnuts also contain special polyphenols that can cross the blood-brain barrier and reduce inflammation in brain tissue, potentially slowing the progression of neurological diseases like dementia and Alzheimer's. What's more, these nuts are a natural source of melatonin, the sleep-regulating hormone that tends to diminish with age, leading to common nighttime issues among seniors. Including walnuts as part of your evening snack routine could help restore healthier sleep cycles. From a cardiovascular standpoint, walnuts are a powerhouse combining arginine, an amino acid that supports blood vessel health, with antioxidants that combat oxidative damage. For those taking medications to manage blood pressure, walnuts may offer added support by promoting arterial flexibility. To preserve their delicate oils, walnuts should be stored in the fridge, and a daily serving of 7 to 8 halves is generally ideal. If you can, buy them whole and crack them open yourself. Not only are they fresher, but the activity also helps keep hand coordination sharp. Don't let their slightly bitter taste discourage you. That flavor is a sign of their potent antioxidants doing their job. Moving on to pistachios, the unsung hero for managing blood pressure. Pistachios often don't get enough credit when discussing health-boosting foods for seniors, but they may be one of the best choices for supporting healthy circulation. What sets pistachios apart is their superb potassium to sodium balance. A single serving delivers around 285 milligrams of potassium while remaining naturally low in sodium. This is incredibly important for older adults, as aging kidneys often start retaining sodium more readily, which can increase blood pressure. Pistachios may help counteract this effect, potentially lowering systolic pressure by 3 to 5 points. They also contain lutein and zeaxanthin, two powerful antioxidants that specifically support the macula, the part of the eye most affected by age-related degeneration, a leading cause of vision loss in individuals over 60. Unlike some harder nuts that may be tough on dental work or sensitive gums, pistachios strike a balance. They offer a satisfying crunch while still being gentle enough for aging mouths. The vibrant shades of green and purple in pistachios aren't just pretty to look at. They're indicators of antioxidant compounds that help fight off cell damage caused by aging. Beyond their nutritional profile, pistachios offer a functional advantage that suits older adults perfectly. Peeling the shells slows down how quickly you eat them, naturally discouraging overindulgence, while encouraging a more deliberate, mindful eating habit that engages the brain and promotes focus. A study featured in the International Journal of Obesity highlighted how the leftover shells act as a physical reminder of how much you've already eaten, making it easier for older adults to control portions. For those dealing with joint stiffness or arthritis in their hands, opt for pistachios that are already partially cracked open. They're easier to handle, but still provide the benefits of the shelling process. A daily serving of roughly 30 pistachios is ideal, and choosing unsalted or lightly salted options is best for managing sodium intake. Each ounce offers about 3 grams of dietary fiber, which supports healthy blood sugar control, particularly important for the 1 in 4 Americans over 65 who are diabetic or pre-diabetic. Now let's talk about the top nut on our list, Brazil nuts, champions for thyroid support. Brazil nuts claim the #1 spot because they're crucial for an often overlooked aspect of senior health, thyroid regulation. These nuts are incredibly rich in selenium, with just a single nut delivering 96 micrograms, far exceeding your daily recommended intake. This is important because nearly 1 in 5 adults over 65 has a thyroid condition, though many go undiagnosed due to symptoms that are mistaken for typical aging. Selenium is vital for activating thyroid hormones, which help regulate energy, metabolism, and mood stability. But their benefits don't stop there. Brazil nuts also contain special fatty acids that help maintain the health of the myelin sheath, the insulating layer around nerves that tends to degrade with age. Supporting myelin may help with coordination, reaction time, and mental clarity. What sets Brazil nuts apart even further is that the selenium they contain is in a natural organic form, which the body absorbs more easily than synthetic supplements. Their rich, buttery consistency makes them especially satisfying, even in small amounts, which is ideal since you only need 1 or 2 per day to reap the rewards. Going overboard can actually backfire, as too much selenium may become harmful. Whenever possible, choose Brazil nuts still in their shells. The natural casing helps retain nutrients and keeps them fresher for longer. It's also wise to keep them refrigerated to prevent spoilage due to their high fat content. In addition to their effects on thyroid and nerve health, Brazil nuts support digestion through a combination of fiber and healthy oils, which can help ease constipation, a common issue among seniors. Their naturally sweet, creamy taste makes them a delicious substitute for processed comfort snacks. Emerging research even suggests they may help safeguard telomeres, the protective ends of chromosomes that shorten with age and influence how we age on a cellular level. Those were the top nuts to include in your diet after age 65. But now let's flip the script and explore the nuts that might not be doing you any favors, and could even be harming your health. Starting with number 4, peanuts, a surprising source of inflammation. Although incredibly popular, peanuts come with several drawbacks that make them a questionable choice for older adults. First off, peanuts aren't actually nuts. They're legumes, which grow underground and are more prone to contamination by mold. This makes them especially vulnerable to aflatoxins, toxic substances created by mold that can impair liver function and potentially raise health risk when consumed frequently. As we grow older, our bodies become less efficient at detoxifying harmful substances, which increases the risk from repeated peanut exposure. What's more, peanuts contain certain proteins that may trigger inflammatory reactions in many people, even if they don't have an allergy. This low-level inflammation can worsen arthritis, elevate strain on the heart, and speed up cognitive deterioration, all issues that older adults are already more likely to face. Another concern is their high concentration of omega-6 fatty acids, which most people already consume in excess compared to the more beneficial omega-3s. For those taking blood thinners like warfarin, peanuts can pose an added risk. Their vitamin K content may interfere with how these medications work, a fact that's often overlooked in routine medical advice. The risks are even greater with conventional peanut butter, which often includes unhealthy ingredients like hydrogenated oils, excess salt, and added sugars, all of which can strain an aging cardiovascular system. Even natural peanut butter isn't always safe, as many versions still contain enough sodium to raise blood pressure, a condition already affecting nearly 2/3 of seniors in the U.S. Improper storage is another red flag. Peanuts go rancid more quickly than many realize, and rancid fats promote oxidative stress and cellular damage. The typical roasting method used in commercial peanut production also creates acrylamide, a compound researchers have linked to accelerated mental decline, especially worrisome for those already dealing with memory challenges. If you've been eating peanuts without noticing any issues, consider switching to one of the healthier options mentioned earlier. Even doing so just a few days per week can significantly reduce your exposure to these harmful substances while improving your nutrient intake. Now on to number 3, cashews, the hidden spike in blood sugar. Cashews pose a unique challenge for seniors because of their higher carbohydrate content, which can cause unexpected blood sugar fluctuations. Unlike most tree nuts, cashews pack about 9 grams of carbs per ounce, while offering less fiber and fewer blood sugar balancing nutrients. This means they can cause a sharper rise in glucose levels, a concern for the 25% of seniors with diabetes and the nearly 50% with pre-diabetic conditions. The issue is made worse by the common perception that cashews are a healthy snack, which leads many older adults to eat them in large quantities without realizing the metabolic consequences. Their smooth, crescent-like shape also makes them easier to inhale by accident, making cashews one of the most commonly aspirated nuts, a serious choking risk, particularly for individuals with swallowing difficulties. From a dietary perspective, cashews pose additional concerns due to their high oxalate content, compounds that can attach to calcium in the digestive tract and interfere with the body's ability to absorb it. This is especially problematic for older adults, many of whom are already at increased risk of developing osteoporosis. In addition, those prone to kidney stones should take extra caution, as oxalates are known to contribute to stone formation, a risk that significantly rises after the age of 60. Another lesser-known issue lies in the way cashews are processed. To make them safe to eat, they must undergo extensive treatment to eliminate urushiol, the same irritant found in poison ivy. Unfortunately, the high heat used in this process can degrade their nutritional value. Many commercially sold cashews are roasted in oils and heavily salted, which adds unhealthy fats and sodium, a combination that can elevate blood pressure and put extra strain on the cardiovascular system. Moreover, cashews naturally contain compounds that hinder digestive enzymes, making it harder for the body to break down and absorb protein. This becomes especially concerning for older adults, who already face declining digestive efficiency and often require more bioavailable nutrients. The smooth, creamy mouthfeel that makes cashews so enjoyable can also lead to oversnacking, which can contribute to weight gain, a common challenge for seniors trying to manage their body weight. If cashews are a frequent part of your snack routine, consider slowly transitioning to options like walnuts or almonds, which offer more balanced nutritional benefits with fewer downsides for aging bodies. Next up at number 2 are macadamia nuts, a surprisingly problematic choice due to their extremely high calorie content. Despite their rich flavor, macadamias top the list for caloric density, packing roughly 200 calories into just a 1-ounce serving. This can be especially troublesome as metabolism naturally slows with age, making it harder for seniors to maintain a healthy weight. They're also extremely fatty, containing about 22 grams of fat per ounce, an amount that can tax the gallbladder, especially in older adults whose digestive function is already compromised. For around 15% of seniors living with silent gallstones, macadamia nuts could trigger painful flare-ups that might otherwise remain dormant. To make matters worse, macadamias are high in saturated fat, about 3 grams per ounce, which can drive up LDL cholesterol, something many seniors are already struggling to manage. Their firm, dense texture also poses a dental hazard, particularly for individuals with crowns, bridges, or weakened teeth, common concerns after decades of wear and tear and decreased calcium absorption. On top of that, macadamias tend to be expensive, which might lead seniors on a budget to opt for lower quality, improperly stored nuts, increasing their exposure to rancid fats and oxidative damage. Commercial versions are often oil roasted and heavily salted, compounding their issues with added sodium and damaged fats. Their indulgent, buttery flavor makes it easy to overeat, especially for those whose taste sensitivity has declined and who crave richer foods. A common misconception is that macadamia nuts are a heart-healthy snack. However, studies that praise the benefits of nut consumption for cardiovascular health usually exclude high-fat varieties like macadamias. If they've been a regular part of your diet, switching to pistachios can provide a similar sense of indulgence, but with far better benefits for older adults. Finally, taking the top spot on the list of nuts to approach with caution are pine nuts, due to a number of serious health risks for seniors. Perhaps the most concerning is their potential to interfere with over half of the most commonly prescribed medications for older adults. This includes medication for high blood pressure and cholesterol, all of which are frequently taken by those over 65. Another troubling phenomenon associated with pine nuts is pine nut syndrome, a condition where people experience a lingering metallic or bitter taste that can last for days after eating them. While it might seem like a minor annoyance, this taste disturbance can reduce appetite and lead to nutritional deficiencies. In fact, nearly half of those affected experience significant weight loss. Seniors appear to be particularly vulnerable to this condition, likely due to age-related changes in taste perception and the body's reduced ability to detoxify. Additionally, pine nuts are loaded with delicate polyunsaturated fats that oxidize quickly, forming inflammatory compounds that are especially problematic for older adults with arthritis or other inflammatory conditions. Their small size and slick texture also increase the risk of accidental inhalation, a serious concern for seniors who have trouble swallowing or take medications that cause dry mouth, which is a common side effect for those on multiple prescriptions. Pine nuts also include natural substances that interfere with enzymes involved in protein digestion, another hurdle for older adults who already absorb protein less efficiently. Even in pesto, where they're most commonly found, the high fat content combined with oil creates a dense, high-calorie food that can sabotage weight maintenance efforts common in later life. Perhaps most alarmingly, new research suggests that certain compounds found in some pine nut varieties may accelerate age-related macular degeneration, the #1 cause of vision loss in seniors. So, those were the top 4 nuts you may want to avoid after turning 65. Being thoughtful about the kinds of nuts you include, or exclude, from your daily routine can make a meaningful difference to your overall wellness, energy, and mental sharpness in your later years. And always keep in mind, even small changes consistently applied can lead to major improvements over time. The information provided in this video is for informational and educational purposes only, and is not intended to replace medical advice. It is important to always consult your trusted healthcare professional regarding any health-related matters. Before you go, we'd love to hear your story. Have you noticed any improvements or setbacks in your health after introducing or eliminating certain nuts from your diet? Which one made the biggest impact for you? Share your thoughts in the comments. We always enjoy hearing from you. Thanks for watching.